We talked to Nurse Erin Oshasky, who spent time on the front lines of the coronavirus pandemic. Now, while she was working in New York's Elmhurst Hospital, known as the Epicenter, she talked about how she witnessed gross negligence, medical mismanagement, and even death. Now, although cases have gone down in New York, but during the height of this pandemic, COVID-19 deaths rose to over 32,000, making it the hardest hit state in the country. Now, if you want to know a little bit about Elmhurst Hospital, it can be traced back to the mid-1800s, an institution known as City Hospital. The hospital was built to serve the poor, and is one of New York's second oldest municipal hospitals. It also played a major role in treating victims of the 1918 flu epidemic. But did you all know that back in March, Governor Cuomo of New York issued an executive order granting immunity from civil liability for any injury or death alleged to have been sustained directly as a result of an act or omission by medical professionals? And let us not forget when he signed that executive order allowing COVID-19 patients to go into nursing homes with non-COVID-19, killing over 6,000 seniors across the entire state. Oh, but that's a whole nother story that we have to dig into. Look like somebody may have blood on their hands. A nurse who turned into an investigator, recording and documenting footage of the sick and sinister foolishness that was happening under everyone's nose, is here to talk to us about what she experienced and what she saw.
This patient is in with like a non-COVID. I don't understand why they're doing that.
I know. There's 4 patients in a row here non-COVID. And this is supposed to be the COVID.
Yeah.
Because 7th floor, they shut it down.
That's right. I'm confused.
And then they're going to have non-COVID there.
Yeah.
This is going to be the only COVID. So they shouldn't put any non-COVIDs here.
Well, that's what they've been doing. The guy over in 29, I had him upstairs because I was on CCU before it.
Yeah.
And he came in with a stroke.
I know, that's what 26-1 was, a stroke.
And no COVID. And now he's got COVID, and he's on a vent.
Well, because we gave it to him here.
Okay, so we're talking to Erin. Erin, I have a whole host of questions.
Yes, a lot.
Yeah. My first question is the difference between working in Florida and New York. What was the difference?
The treatment, the whole entire protocol. All of it. In Florida, we treated the person as an individual. We looked at the whole big picture. We also wouldn't go immediately to a ventilator. We would try other treatments. For example, this is like one of the biggest differences that I noticed between Florida and New York was that we used, and we were successful using, the hydroxychloroquine and zinc protocol. And when I got to New York, that wasn't the case. It was banned. We couldn't even use it even if we wanted to. And the crazy thing is that there was a liability-free environment, correct? Healthcare workers were liability-free, except if they used the hydroxychloroquine for off-label use. AKA, if they use it for COVID, those physicians would be liable and they would lose their job, possibly lose their license.
Oh, okay. So let me say this here. Let me make sure I'm clear about this here.
Yeah.
So if you worked at the hospital, you couldn't use any of the hydroxychloroquine. You couldn't use any of it. But if you decide to use it, the doctors were liable. But any other thing that they did, they wasn't liable for.
Correct.
Wow. I know.
Yeah.
Go ahead.
So did anybody argue or mention anything about the right to try law that was written into place?
I did. So when I first got there, when I just realized that there was such a vast difference in the way we were treating our patients in Florida versus when I got to New York. I couldn't believe it. And early on, I reached out to an attorney friend of mine. I'm like, listen, no one is going to believe this if I don't have some sort of proof. So we started getting proof via video and audio. I had recorded a doctor that I asked him specifically, well, why can't we use the hydroxychloroquine? Why can't we use any alternative treatments for these patients?
Right.
They didn't want to. His answer was, they don't work. And I'm like, well, they were working by me. In Florida, we didn't have all this death. We didn't have any of these problems. And, you know, he didn't really have a good answer. He goes, that's not the best protocol. And I'm like, well, listen, these patients are dying. You just admitted that if they're on a vent, the chances of them living are slim to none. He just admitted that at Elmhurst, none of those vented patients have went home. None of them have been successfully extubated. So I'm like, what's the harm?
Okay, Erin. Okay, let's break this down. Somebody goes to the hospital. They claim that they may be having shortness of breath, that they have a fever. What determined how people was checked into the hospital, how you were admitted? If you were thought to have COVID or if you had COVID?
Yeah, what were the symptoms?
Yeah, we know what the symptoms was. It's shortness of breath, it's fever. We know that.
Right.
But when you get to the hospital, what was the protocol for them even to be admitted to the hospital?
Okay, yeah.
So they weren't admitting anybody that wasn't, like, they turned the hospital into an all COVID hospital.
Okay.
So, you know, now that didn't mean that everybody admitted had COVID, which I found really interesting. And anyone that, you know, you don't have to be a rocket science to figure out that if you're going to admit somebody that's a COVID rule out while they're waiting for a 5 to 10 day test, you're not going to put them on a COVID floor, right?
Stop right there, Erin. If the whole hospital was the epicenter, are you telling me that every floor was a COVID floor?
The majority of floors, they had a medical surge floor, but they were still admitting COVID patients there. So they were admitting patients, either they were COVID positive or they would be considered COVID rule out. So a COVID rule out, which I found, this is another question I ask, and you know, you ask questions and they don't like that, but I don't care. I'm like, these are patients' lives right now. And the entire United States is looking at this hospital in particular and basing all of their recommendations off of this. So, but I asked the doctor, and there was rapid tests that we could have done at that time. Rapid tests are 45 minutes. So in the emergency room, we can rapid test someone, know if they have, you know, they're positive or negative. They bypassed that. They didn't use it, and the doctor said it's too expensive.
Hold up.
Wow.
So did the hospital have them on hand, or they just didn't want to? Or did they have that particular, the rapid test on hand? Was it inside the hospital where you can get your hands on it?
No.
Okay, so the hospital wasn't doing rapid tests. What they were doing was this, how many days? 5 to 10 day tests?
Yeah, approximately. And in the meantime, they admit these patients that usually didn't have COVID to a COVID floor. So ultimately, those patients end up getting COVID.
Right.
Let me make sure I got this straight, Erin. Let me make sure I got this straight. People will come to the hospital. They wasn't tested for COVID. I'm gonna throw this in there. If they had something else, maybe they was having heart palpitations. They still was admitted into the hospital and placed in with COVID-19 patients. Positive patients. Is that what you're telling me?
Yeah, they would do a test on them. And they would send it out. But in the meantime, they would admit him to a floor, and they would wait for the results.
But what's
Even the results
okay,
wasn't bad.
now let me ask you this here. As a nurse, what is the protocol for being admitted in the hospital? Like, they don't just admit you in the hospital because you may feel a little sweaty. I mean, what was the protocol for them even admitting people into the hospital and just placing them on these COVID-19 floors with other COVID-19 patients, and then doing a test that's take 6 to 10 days to come back? By that time, that patient, they may have caught COVID. But what is the protocol for them even admitting these people in the hospital like that? Was it a new rule?
The problem is that all liability was removed from all healthcare providers. And so it ended up becoming a free-for-all. And then already, the people that are coming into this hospital specifically, a lot of them are on Medicare and Medicaid. A lot of them don't have, the means to be able to fight the system per se. So they were essentially, and this is my opinion as an observer, as being in there as a nurse, is that they were essentially taken advantage of. And their lives were lost because of that. Mismanagement, malpractice, gross negligence, you name it, and it was happening. And guess what? If you asked any questions, bye. I was kicked out. But not before I got proof.
Okay, let me ask you this, Erin. So if someone came down with COVID, the treatment protocol, did they immediately want you all to throw them on ventilators, or did they follow a specific protocol, a specific plan, so that they wouldn't go on to the ventilators?
Like a process of elimination.
Right.
Oxygen.
Yeah. So, there's good and bad apples on every tree. So there were doctors that would try to put them on a BiPAP or a CPAP early on. But that doctor goes home, the new doctor takes over on a different shift and is sick of dealing with it because it's a lot more work. You got to keep going in the room, checking on the patient. And it would be easier for them just to put them on a vent. And a lot of us nurses that saw that this was happening fought back. What are you doing? He doesn't need a vent. He doesn't need this, or she doesn't need this. And they didn't listen, because it was honestly a free for all. A lot of the residents, they have the book smarts, but now they need the clinical skills. We're running the show. Well, early on, and before I got there, I was trying to figure it out, what is really going on? Where is this coming from? And grasping at any doctor or scientist that was speaking out. And I ran across Dr. Cameron Kyle-Sidell.
Okay.
And he, early on, this was mid-March, stated that, we're doing it wrong, people. We're doing it wrong. We're treating people wrong. We're not, it's the wrong thing. It's in the blood. It's a blood issue. And they knew this. I brought the science to them. I showed them, and nobody wanted to hear it. This is affecting people's bloods. When I would go to take, their blood for lab work, it was almost impossible for me to even fill up a lab tube because it was so thick it would stop. So I can't explain it, but all I know is that it's in the blood. If the blood is clotting, that's our main oxygen source to our organs and our body, and they knew that. They
but
can't.
The test that they were taking was the swab up in the nose, correct? It wasn't for blood; it was for mucus.
Correct. Yeah, I don't know. I don't even know how accurate those tests are, to be honest with you.
Okay, so I'm sorry. One more. So when you just mentioned something about the oxygen leaving the organs and everybody's body, it sounds like a person would need oxygen versus a ventilator, because it does not sound like something was wrong with the muscles of the person's lungs working. It sounded like oxygen was not getting into the person's body. So with you being a nurse, did you know that a ventilator was not what a person needed if their lung muscles were still working accurately?
Yeah, it was awful because we would literally be begging them, like, please, but they wouldn't allow any alternative treatments.
Mm.
And the thing that bothered me is that there was an incentive to put patients on a vent, and that's sad. Like,
What was the incentive?
What was the incentive?
$39,000 per patient on a vent.
Wow.
Wow. $39,000 for a patient. Let me ask you this here. As a nurse, you went to nursing school, you follow the protocols.
Mhm.
They have specific protocols for things. When you got to this hospital, the Epic Center in Queens, New York, did the rules change? Things that you were supposed to know or should have known, did all of that go out the window? And if it did, who ordered that? Who ordered that? I keep hearing the higher ups. Who were the higher ups?
Good question. I'm asking too. Nobody knew. Everyone blamed it on, it's our higher ups. Like, who are they, and where are they? But yes, the majority of protocols that the average doctor, nurse, staff learned throughout their years in school went out the door. For the majority, yeah. And it became where people were just kind of conditioned to say, this is how it is, just deal with it, they're gonna die anyway.
Wow.
And like, I'm a mom, I can't even imagine if that was one of my children in there, and I can't be in there with them because
you can't see them.
Family are kicked out.
Wow.
So what do they do? They're at an event, they can't even talk to you at that point. You gotta be there for them.
Erin, how many people did you see die?
I didn't have one patient live.
Wow.
Yeah.
And this was one of the low-income hospitals, a hospital that most minorities go to. And I don't understand the governor of New York. How can he claim Black Lives Matter to him when all of the protocol is thrown out of the window? And you have people just doing whatever I guess they want to do, or according to what the higher ups want them to do, even though looking in, I'm questioning people, even their integrity, as to go along with
morals, the values. And even just hearing you say that this is a hospital that serviced minorities, I understand, okay, Black people are considered minority. Was there also Hispanic people there as well?
Right.
Yeah, that was the main population in this hospital is African American, Black, Hispanic, and Asian. And they were treated like they were disposable humans.
Wow.
I have a friend that worked in the emergency room, and she said they would bring a lot of homeless in through the emergency room, drug them up, and send them to the floors.